Every community is different. Every community has its challenges and every community has its strength. But the one thing we need in all communities is education about chronic kidney disease. Chronic kidney disease is on the rise, and African Americans make up about 15% of the population, but makes up about 35% of the people with kidney failure.
Kidney health education is universal to all communities, and it's needed in every community, no matter ethnicity, race, etc. I think it's very important to people my age to not only be informed about their kidney health, but maybe become kidney health coaches themselves.
The Kidney Health Coach program, this is a boots on the ground that people are able to have a conversation and talk about what can be done, where can I get access.
The thing that inspired me to become a kidney health coach is the love for community.
I want to make sure that the community knows that we should be having conversations with our providers.
Pine Bluff, Arkansas right now has about 42,000 people. African American population is about 70%. Diabetes and blood pressure leads to kidney failure. And if we can get out there and get that word out, then we can prevent people from ending up on dialysis. 9 out of 10 people don't.
Presentations like today's for chronic kidney disease are really important to this area because it is full of Native Americans and Hispanics that are at a higher risk for chronic kidney disease. So giving them that knowledge and that education of really what it is and the understanding will really help them.
Here you are in Beltsville, Maryland. It's underserved. There's a lot of barriers, access to resources. The other barrier is language. 90% of our community, people who speak English as a second language, they are born outside the United States. The coaches are there to raise more awareness to what the chronic disease is and put more awareness in the communities.
The patients, they already are hooked.
But when you have more information, you have more sensibilization about this situation, maybe more people will say, I'm concerned about that. But I think one thing we have to do, it's education.
It's very important that people learn to live healthy lifestyles. And that's the reason I'm so excited about the health fair that we're having here today. Sharing that information, because I think there are many times people don't really know, they're not consciously aware of healthcare services that are provided right here in their community.
I've been a kidney health coach for a long time, and so when I became aware of the Kidney Health Coach Health Equity Grant, I said, we gotta apply for this grant. We need this grant. We need to be out there educating our community on chronic kidney disease.
It's 2 simple tests that they do. So that grant will provide money to put boots on the ground, where you'll have individuals going to the areas, to the homes, to the communities, to the beauty shops, the barber shops, places where these people frequent, and make them aware of those services that are there.
We have 20 members out in the community talking about Kidney Health Coach program as well as kidney disease. So we have these people, they're speaking with their other organizations.
Well, thank you so much for wanting to be a kidney health coach.
We have seen a difference since implementing the grant. People are much more aware of what the chronic disease is. Now they're more willing to go out there and seek a specialty, because a lot of people had no idea that there's actually a specialty for chronic kidney disease.
Knowing that blood pressure actually affects chronic kidney disease, that was something I didn't know. And then, of course, how your diet and exercise really plays into that.
Becoming a kidney health coach is a very simple and easy process. All you have to do is go to kidneyfund.org. It's very interactive, and afterwards, now you're formed to educate others about kidney disease.
We need more people who are more representing of these communities, who speak these languages, who understand lived experiences.
The Kidney Health Coach program has been very, very beneficial for Pine Bluff. This grant has allowed us to go out there one-on-one, individually, and share some really good fact-based information.